Hello, I'm Dr Hilary Jones. I'm a family doctor, a GP, and also I'm a medical broadcaster. Some of you may have seen me on daytime TV or radio. But most importantly, I am a patient too, and a one-time sufferer of chronic low back pain myself. So I can talk about chronic low back pain quite sympathetically, hopefully. Well, what is chronic low back pain? What do we mean by it? Low back pain, obviously, is pain felt in the small of the back, lower down, usually in the middle. And chronic doesn't mean, as some people think, severity of low back pain. It means that it's been there for more than 3 months. So it talks about the duration of the low back pain itself. And of course, it's very common. We know that about a third of the British adult population suffer from chronic low back pain at any point in a year. And 20% of these people who suffer will go and see their GP, which means that 80% don't. So a lot of people are suffering in silence. What causes it? Well, the causes are varied. Usually it's a mechanical problem in the muscles or the ligaments of the spine, often caused by gardening or bending or lifting awkwardly. Sometimes, however, it's pressure on the nerves as the cartilage, the cushion between the vertebrae, moves and presses on the nerves, causing something like sciatica. That's a slip disc. It affects people, of course, in many different ways. Some people will be affected because they can't play sport or they can't be as active as they want to be. For me, at one point, I couldn't actually get my socks on in the morning. I couldn't bend that far forward. I couldn't get in and out of the car. And many people will suffer similar kinds of symptoms. What about the types of low back pain? Well, doctors talk about two main types. The first one is called neuropathic, which means pain emanating from the nerves. And here, most people will describe symptoms of a burning sensation or a shooting pain, such as they feel in sciatica when pain shoots down the back of the leg into the foot. The other type of pain is called nociceptive, and by that we really mean tissue pain. And here, a patient might suffer from stiffness or tenderness in the muscles concerned. Even more confusingly, perhaps, sometimes the picture is a mixed picture, so that there's both neuropathic and nociceptive pain. So there might be stiffness and tenderness and burning. It's really important to try and help your doctor to determine the cause of your problem. And that's not always easy because everybody's different. But if you go and see your doctor and you have a way of describing your back pain, that's really helpful in reaching that initial diagnosis. We'll be telling you how to describe your back pain in the very next film in the Pain and Simple series, and later on we'll be encouraging you to keep your back on the move, whatever the cause of the pain. Just sometimes getting out of a chair and moving around every half an hour or so for a few minutes is really helpful in preventing that stiffness. Join us later to get more tips on how to manage your back pain.